Are you concerned that back surgery may be in your future? I'm Dr. Rob Campbell, and I have a non-surgical solution that is safe and highly effective for the right candidate.
I have multiple herniated disc in my back. I was a candidate for surgery. I don't want to do that. After meeting Dr. Campbell, now training for a full marathon. It changed my life.
Our unique method allows your herniated disc to self-repair without side effects. Avoid the injections and surgery. Call today for your no-charge appointment.
Welcome back. Well, today we have on Dr. Rob Campbell. He's been on before, known as the disc expert, and it's good to have you here today.
Thank you.
You brought along a patient, right? Leslie Howard.
Leslie.
Nice to meet you today.
Nice to meet you.
And let's first talk about you, Leslie. How did you come across Rob, and how did you decide that his techniques were right for you? What were the problems that you were having?
Oh my gosh. I had major pain going down my right leg.
Okay.
And to the point where I could barely walk.
Mm-hmm.
I'd been dealing with it for about a year or so. I'd been to pain management doctors. I had steroid shots. I did physical therapy, you name it. Nothing was working. And I ran into a friend of mine at work one day, and he saw me limping back to my office to get some Vicodin. And he somehow thought of Dr. Campbell, so he sent him an email to see if what his procedures would do, if he could help me. So he sent me an email. I called Dr. Campbell right away, the minute I got the email, and I was crying on the phone. I was in so much pain. He got me in right away. It absolutely, everything he does made perfect sense to me. The pain management doctors were simply managing the pain, and they weren't doing it very well. So the explanation of what he does was perfect. So I thought, I have nothing to lose. The next step was going to be surgery. So I saw him, and here I am.
And Dr. Campbell, she said something about the pain going down her leg. And sometimes when you hear that, you think of, what's the nerve, sciatic nerve?
Yeah, the sciatic nerve.
Yeah, is that basically what the problem she was having?
Yeah, when the disc is in trouble, it's bulging onto the delicate spinal tissues.
Mm-hmm.
One of the nerves that it presses onto is the sciatic nerve, and that is a very common condition that people have, is sciatica. So they have pain from sciatica, and they go to doctors to try to control that pain. And what's different about what we do is we actually get to the root cause, which is not a pain problem, it's actually a disc problem. In her case, that was exactly what she had.
Okay. Had her disc, or just one or two, or a bunch have degenerated a little bit? Exactly what did you find and what happened?
Yeah, what we see and how we see this is by looking at the MRI. And the MRI shows us, it's the gold standard of looking at the disc to determine the state of the disc. And in her particular situation, the MRI revealed that the disc had collapsed. And when the disc collapses, it bulges, and it bulges in that particular area on that exact nerve and causes a specific symptom. So that's qualifies her as a candidate.
Okay. So what was the result? How long ago did you have this? First went into a Dr. Campbell, I should say?
I saw him for the first time in early December.
Okay, so it's been quite a while then. It
Yeah.
was quite a while back. Okay.
Yes.
And what is the results for you now?
Well, I just happen to have two medals here. In March, I did a 5K, and 2 weeks ago, I did a mud run. That's the difference. When I called him, I could barely get out of bed, and I just did a mud run.
So what are, as far as what you did for Leslie, is it something that's ongoing, or is it a treatment that lasts for a couple months, or every month she comes in? What is it that that you do that keeps her being able to run like this, and not having that disc recollapse or whatever it might happen?
You know, and that's really what it's all about, is actually fixing the disc. But the most satisfying thing is, especially in Leslie's case, is to see her go from you know, when I first met her, literally in tears on the phone, to now she's able to do normal activities of her life. And she's able to do that because our procedure is specifically for this one condition.
Okay.
Just as one condition of her disc has failed. And it's all about the physiology of the disc breaking down. And no one ever really explains that to the patient when they go into their pain management doctor or their surgeon. And there's no knock on these doctors or their treatments at all, because what they do is different than what I do. But no one explains how the physiology of the disc actually works. And when the physiology stops working, that's when the disc breaks down over time. And pretty much all of my disc patients at one point or another did not realize that they had a disc problem. And it's really until it gets to a point where it's really bad. And the people that we see are the people who tried everything. Like Leslie has been to pain management. She's had numerous injections and all these things. And these are typical of the patients that we see. So when everything has failed, that's where we step in and actually provide a treatment that's specifically for the disc.
Okay, and I know you have these models here, and we see, obviously, I guess this would be a nice healthy disc here. And
Yeah, this is
as
healthy.
it degenerates.
And these are unhealthy, and these are the stages of degeneration that the disc goes through when the disc's mechanism of self-repair breaks down. And that
Okay.
happens due to trauma. And the trauma can be something that someone is very well aware of, maybe earlier on in their life, or it could be something that was seemingly insignificant to them, but it did affect the disc. And now it's gotten to a point where it's broke down, and that's where we see it on the MRI.
Okay, so I don't know where Leslie was on this scale,
I
but
think I was there.
Well, not quite. You were more like here, but heading in that direction. So
is it being able to get this back to this? Is that
No.
a possibility,
That-
or
that-
just to?
this example here,
okay.
there are cases where they're too far gone,
Okay.
and this is why we need the MRI to evaluate,
Okay.
is that patient a good candidate? If their disc is too far gone and there's nothing really to work with, then we can't help them, and we have to
Right.
identify that.
Okay.
Or if they've had too many surgeries, they're not going to be a candidate.
Okay.
So we'd like to get them in the earlier stages. Even in the earlier stage, we can still help them, whereas you know, typically in this situation, they will not do surgery. They will like to wait till it gets down to here. You don't have to do that. It actually can come back in that direction. But we're not looking at getting this back to this. We're looking at making whatever we've got as healthy as possible, and there is a way to do that, and that's what we do.
Okay. Does the disc actually get stronger or regenerate itself, or I don't know.
It actually does,
Okay.
and the reason is because science and research tells us through published studies that the disc has significant mechanisms for self-repair. It's living
Okay.
tissue, and these mechanisms are what we tap into. There is a delivery system that the disc requires in order to get what it needs, the
Okay.
water, oxygen, nutrients, and that's what we utilize in our procedures.
Okay. So again, that's why you need that MRI, because you want to see first out, am I going to be able to help someone? If you see that it's to a certain stage, you're up front and saying, I'm sorry, you're at this point that you may have to seek something else. Am I right?
Yes, we look at the MRI on the very first visit, or we send out for that, and we have to see that before we even are able to determine if they're a candidate. That is the kingpin. We have to see if they're a candidate based on the MRI. And then also the other scenario here is that we explain and we teach our patients what we do, and that's a very big part of what we do. I think Leslie, she's nodding her head over here, she agrees with that. We have to
Definitely.
teach you because no one else is teaching you, and if we don't do that, then simply using anything that's out there, like any type of medication, injection, or machine or device to control pain, is not going to actually fix the problem. So when you understand what the actual problem is that the disc has broken down and understand how it's broken down, then you can easily understand how we
Okay.
fix it.
Okay. Very good. So how often do you go back to see Dr. Campbell?
Well,
Is it-
I finished the initial treatment, and now I'm in aftercare. One or two times a month.
Okay. All right. Very good. So, if someone thinks that they may be a candidate, obviously the first thing is to contact you. You'll talk over with them to get an MRI if they don't have a current one, and then you go from there. And obviously, if it's someone like Leslie, you can really help them out.
Yeah, it's all about an educational process from my standpoint, where we want to teach the patient what their problem is
Okay.
so that they can make the best decisions.
All right, very good. The website is thediscexpert.com, 949-702-4582. Nice to meet you.
Thank you. Nice to meet
And
you.
go have more runs. There you go.
Okay.
All right. All right. We'll see you again soon. Take care.
Thank
We'll be
you.
right back.
Are you concerned that back surgery may be in your future? I'm Dr. Rob Campbell, and I have a non-surgical solution that is safe and highly effective for the right candidate.
It was amazing. I have now completed a 5K, and I just signed up to do a mud run in June, so I'm really excited. He's absolutely changed my quality of life.
Our unique method allows your herniated disc to self-repair without side effects. Avoid the injections and surgery. Call today for your no-charge appointment.